Hi everyone, and welcome back to the High Impact Medicine podcast. High Impact Medicine is a community of doctors and medical students hoping to lead impactful and meaningful careers. This podcast chats to medical doctors pursuing diverse career paths, ranging from public health, entrepreneurship, humanitarian medicine, and so much more. As medical students, we want to do the most good, but it is not always clear where to start. I hope these discussions will leave you informed and inspired. Today we have a very exciting guest. He is the clinical lead in infectious disease at the Nunavik Department of Public Health in Canada. He's an assistant professor in the Department of Global Health and Public Health at McGill University and also currently serves on the steering committee of the WHO Youth Council. He has varied advocacy experience in representing organizations like the WHO, World Medical Association, and the International Federation of Medical Students Association in front of the United Nations. So welcome to the podcast, Dr. Yassen Tcholakov. I'm looking forward to our conversation today.
Thanks for having me.
So, beginning at medical school and ending where you are today, could you give our listeners a broad overview of your career path?
I started med school directly after high school in Canada, and since the very beginning of med school, I got engaged into IFMSA Quebec. So that's the local branch of the International Federation of Medical Students Associations, IFMSA. And through that organization, I was exposed to public health, global health, and eventually got the opportunity of doing all kinds of things at the international level, all kinds of advocacy in public and global health at the international level. Through those exposures, I also developed that as an interest, and I eventually identified that I was interested in pursuing further education, and I intercalated a year to do a Master's of International Health at the Copenhagen School of Global Health. And during that year, I did a bunch of things, but also got involved in climate change and health and worked as an intern at the WHO in the climate change and health team, and kind of got even more engaged in some of those activities. All of that then progressed. I came back to med school, did my clerkship years, and then at the end, in Canada, we directly match into residency in a similar way as things work in the US. So as I was finishing med school, I had to decide what to do, and I was kind of toying different types of residency programs, but in the end, I decided to do public health and preventive medicine because of the opportunity to continue doing some of this global health work, but also because for a bunch of reasons that I found our capacity to affect populational health at that level much bigger than in one-on-one interactions, as most often is the case in clinical medicine. So yeah, and then I continued global health engagements throughout residency, throughout the 5 years of residency, with the World Medical Association. So having graduated from med school, no longer being a medical student and no longer being able to engage in the same way with the International Federation of Medical Students Associations, well, I kind of translated that to the Junior Doctors Network of the World Medical Association. So very similar organization and structure, but for licensed doctors once you finish training. And that's something that I continue to do and that I still do to this day. And it's an organization in which I had various leadership roles, including being the chairperson of the Junior Doctors Network between 2020 and 2022. Yeah, now I'm kind of retired from my formal positions, but still very engaged in a couple of areas of work.
Cool. Thank you so much for that detailed overview of your career. So it seems like you were really involved in these committees during medical school. Can you tell us a bit about what drew you towards public health and getting involved in this area?
Yeah, I mean, I guess it was the interest of being able to influence things that were determinants of health and things that were at the root causes of some of the health issues that we see amongst our patients, amongst the population, and that capacity of having a broad impact on whole populations. I found that very rewarding, very meaningful, and that's how I ended up here. Kind of very pointedly, the story of why I chose a public health residency versus other things. Um, my clinical, I really enjoyed clinical medicine, and I still do. I found it quite fun to have those interactions one-on-one with patients, to be in a clinical setting and helping people out. But what I enjoyed the most was very acute medicine. So things like working in the ICU, working in the emergency room. Um, and I recognized as I was graduating from med school that if I chose to go in a residency like that, I wouldn't be able to pursue some of the global health advocacy activities that I was already involved in. So I made the decision to actually go into public health in order to be able to continue and do both. Because in Canada, when we do public health and preventive medicine training, we can cross specialize as well in family medicine. So I kept doing clinical work for a good many years after I started residency. I only stopped really at the beginning of the pandemic. And since then, I've been essentially working in public health just because there's so much work to be done.
Yeah, definitely. And we'll talk more about your particular interest in public health. But before we go on to that, you mentioned doing a master's program. What was going through your head at the time, and why did you take this decision?
I had gone into med school directly from high school. Some people had more experience having done bachelor's degrees or having worked or having all kinds of other life experiences. And I found that I wanted to do something more, and I already had this interest in global health. So the master's itself was a master's of international health. Um, and I had seen the university, interacted with them actually through the IFMSA, through some of the activities there. I had been in Copenhagen at a General Assembly meeting, had seen what kind of they were offering, and that eventually led me to applying there. Um, but yeah, it was essentially kind of curiosity and desire to do something different for a little bit that made me intercalate, and then that evolved. Obviously, I think if I look back now, maybe my choice of what I decide to train in, I would have given myself advice to do something slightly different, but I had a great time, and I think circumstances led to an interesting place.
Awesome. And you also mentioned you interned with the WHO. What was that like?
Yes, I did indeed. Um, I interned with the Climate Change and Health Department for only a few months. Basically, essentially how it worked, we had some time in the master's program for working on our final thesis, and I was writing my thesis on essentially communications around climate change and health, and I interned with the department here at WHO in the Climate Change and Health unit. My work was not really directly related to my master's thesis, but they were in a similar field, so I got to meet relevant people. I got to have a first-hand experience with what what the World Health Organization was doing in this field. That kind of helped me also finalize other pieces of work. It was a uh, good moment to do more than one thing at once.
Sounds like it's been very valuable in giving you some direction as well, and it's clearly kind of launched this career in public health for you. Um, you've also been very busy on various different committees and volunteering roles. I was reading that you volunteered with the World Medical Association for 7 years. Kind of what was your role with that, and why did you get involved?
Yeah, so the World Medical Association is essentially a professional associations. So it's the organization that represents doctors internationally. And similar to what I've described, my engagements in med school through the IFMSA, in a similar way, that this all of my activities with the WMA are in volunteer capacity. The organization has a small secretariat, but relies a lot on national medical associations to help out with work, and groups of interested physicians like associate members and like junior doctors that are engaged in the organizations to drive certain things. So I mentioned the Junior Doctors Network. That's kind of the group, if you wish, where I was engaged. It was created in 2021, so it's 2011, sorry. So it's essentially a relatively young group, but it serves as a platform for junior doctors to be able to connect from different parts of the world, from different countries and regions, and to work together on joint areas of interest on medical education or global health or global public health. So we have working groups and so on. So during those many years, and I'm still involved with the WMA, even though no longer hold an elected office, if you wish, in the Junior Doctors Network. Um, During those years, I had held various positions, organized. Um, Essentially for 2 years, I was the person in charge of what's called socio-medical affairs. Not very clear to an outsider what that means, but it essentially means global public health policies within the organization, making the link between junior doctors' perception of them and what the organization does, and organizing some activities for the membership. And then I was the deputy chairperson for 2 years, and then the chairperson for another 2 years within the organization.
Yeah. You mentioned health advocacy there and diplomacy. These can sometimes feel like quite nebulous terms. I was wondering whether you could help us understand what it means to be involved in health diplomacy.
Yeah, I guess health diplomacy, maybe the easiest way of describing it is the act of getting together, different stakeholders getting together. Oftentimes, we're talking about countries here at an international level negotiating with each other, but it doesn't necessarily have to be. Civil society organizations like NGOs also have an important role to play in that, and sometimes a role in deploying some of the actions that follow those negotiations. But diplomacy is essentially kind of getting together and jointly finding what is the kind of an agreed path forward on the specific issue. As we're speaking now, I'm actually here in Geneva at the WHO, where there are negotiations. There's diplomacy going on around the pandemic accord, or sometimes pandemic treaty, as it's called. So this work follows the fact that we saw many um, shortcomings into our global system, the way that we're organized, the governance system at the international level during the pandemic. We saw countries being punished for having done the right thing and having declared that they had certain variants within their borders. We saw great inequities in the distribution of all kinds of resources related to the pandemic, be it vaccines. We talked a lot about vaccines, but also basic things like PPE, masks, medications, all of that. Our global system can do better, and we can have a system that ensures that those resources are distributed equitably, and that we're better responding, that everyone actually pandemics last shorter time, pandemics never, or epidemics never progress to pandemics, and so on. So this the objectives of what's being negotiated. So long side story, but the diplomacy is the act of negotiating to find the best outcome. uh, Health diplomacy for health things, but can be applied to many other fields.
Okay. So you represent health workers, but then you're bringing them to a platform with several other stakeholders. And I imagine you work with a lot of different people from different sectors. So like, tell me a little bit about who you work with on a day-to-day basis.
I guess in spaces like this, the majority of countries are represented by diplomats, or those diplomats sometimes have technical expertise in health, sometimes have technical expertise in other fields, but essentially they're there to be able to bring their national interests. That's what all countries do. They bring their national interest to the table, find a way to come up with a joint solution that manages to bring their national interests forward. Um, but often, when you put everything together, in theory, there is a path that everyone benefits. It's often not a zero-sum game, even though sometimes, and you'll see a lot of this in media and social media, a lot of the disinformation tries to portray things as zero-sum games. So a lot of it is diplomats from countries, so civil servants from countries. This being said, there's NGOs. Health workers are one type of NGO, but there's other types of NGOs as well. NGOs that represent specific topical areas, that work on a specific in a specific field. For example, um, the pandemic space, it's a bit more complicated, but for instance, there's NGOs that are dedicated to climate change and health. So when those climate change and health discussions are happening here, their usual spaces is the environmental space where most of the climate change discussions are happening. But they also interact in the health space when there's things that have to do with that come here. Obviously, with respect to health negotiations at large, oftentimes pharmaceutical companies are also engaged because they're a contributor to a key health resource.
Yeah, that makes sense. And related to that, kind of how do you think your medical background brings perspective to these discussions?
Yeah, a lot of the conversations here are about specific health issues. So having that understanding of that goes all the way down to the pathophysiology. Why does disease arise in an individual is important because it makes us, it sometimes underlines that the solution is at one place, whereas we're discussing something completely different, something that may be systemically important, but that's not actually going to bring the solution down to the patient. So having that experience from seeing patients in all kinds of contexts. It doesn't necessarily need to be medical. There's other professionals or other health workers that see patients in a similar way that have a very valuable experience to bring. But seeing patients one-on-one that have diseases, that have good health, and then kind of translating that, well, how can we make this be the case for less people in one in the case of bad health, more people have their ways of keeping people healthy, how to translate that into policy that work at a national level and at an international level are all like different, if you want, concentric circles of the same issue. In the end, it's the health of an individual that we're trying to improve.
Mhm. Yeah, awesome. So it sounds like it's pretty important for doctors to be in these spaces and to contribute to the decisions that are made. Um, to find out a little bit more about what a day in your life looks like, I know this is probably quite variable. You're currently at a conference in Geneva at the WHO, but in general, what does a residency in public health look like?
Mm. Uh, Very variable, I guess. Public health is a broad field in and of its own. Um, so it depends very much if you're working into what I'm currently working on, which is essentially health protection, where I do a bit of surveillance, so try to look at health indicators of the health situation of the population that I'm serving to see if there's some things that are off that we should be acting upon. Um, then there's elements of health protection in there where, well, if there's a problem, we have to resolve it. So sometimes problems get declared to us. Someone calls us up, there's a disease that's a mandatory declaration, or there's something weird that's going on and someone calls us up to let us know. Well, we take in that information and then analyze it and try to decide, well, is there something that we can do to protect the health of others? The one patient, they're usually taken care of by the health system. But sometimes there's certain things that when there is one patient sick, that means that others could be sick or could be getting sick shortly thereafter. And that's where the public health role is. If you have this one person that's sick, is there something that you can do for others around them? Um, and yeah, so that a lot of that. And then there's also like, I guess, policy making around health. During the pandemic, people everywhere witnessed it. So it's applying rules for masking, for travels, for vaccination, deploying certain programs like, well, making sure that there's vaccines available, trying to decide who should we prioritize for vaccination programs if there's a resource that's limited or a medication that's limited, and drawing up those guidelines, those rules. That's also part of public health. So all of these kind of pieces, um, I guess it's not a good description of one day, but it's a description of things that you may or may not have in any single day in the roles that I have. And there's different roles that people can play in public health as well. People who work in health protection, they have a bigger balance of developing programs and working with communities to see how those programs can be best deployed. Whereas me working in health protection, I have a lot more of reactivity to external triggers that have to be done quickly. So yeah.
You mentioned earlier that due to the demands of wanting to pursue kind of all your activities in public health, you chose to do a residency in public health, which would give you the time to get involved in all these committees. I was wondering, do you miss practice clinically, or is this something that isn't really on your radar anymore?
I would say it's not concretely on my radar, and like I said earlier, I think it's important to underscore that I did enjoy it, and it was very fun, and it's quite nice to have a balance of different fun things that you're working on. So kind of you're doing one thing, and then you change a bit the dynamic very much, and clinical work allowed me to do that because oftentimes you see a patient for a few minutes, 15, 20 minutes. And then at the end of that encounter, usually you kind of, oftentimes at least in family medicine, when you're doing walk-in clinics and there are small issues that can be solved quickly, well, everyone ends up happy. Patient got a small fix for a small issue. They don't always have a small issue, but sometimes there's a small fix, a small issue. They're happy, you're happy, and it's kind of very rewarding kind of interaction. Whereas in public health, oftentimes we're kind of working on a very protracted process for something that will come to fruition in a few months at best. Oftentimes in many years, it will take many years for us to see the impact of our work, and it's a different dynamic. So you have to be willing to work like that if that interests you. But yeah, I chose to work essentially only in public health as of the beginning of the pandemic because I didn't have enough time and I saw that there was a lot of work to be done in public health. And also because it allowed me to continue my engagements in global health. So yeah, maybe I did the earlier spiel of what I do a bit improperly. I discussed everything that I do outside of my regular job, but my regular job is being a public health physician in northern Canada. So in a remote and indigenous region in Canada, where I'm the head of the infectious disease team, the clinical lead for the infectious disease team. So my role it touches upon everything. Like health protection is the main thing, but I do a lot of surveillance. There's some health promotion integrated into my role in infectious diseases, and some health services that we are responsible to directing, if not sometimes delivering. So yeah.
I think there you've really kind of summed up both the joys and the challenges of the work you do. There are kind of you lose the immediate satisfaction of a clinician's work, but at the same time, now you get to work on a long-term project that hopefully will help a large number of people. So moving on to a bit of advice and some actionable steps for our listeners. Do you think it's important for medical students to take an active interest in public health?
So yeah, definitely important for medical students to learn about public health, and it should be part of the core curriculum pretty much everywhere there's medicine. People should learn about public health and determinants of health and how to do it. Obviously, I think certain things are of the domain of every clinician and other things are of the domain of you want to learn more about this, you want to work in this area, and then you can pursue further training. How to accomplish that, I think every country has to define their curriculum and identify those core competencies and how to deliver them to medical students. But I think individuals should also kind of look around them. There's often organizations that facilitate opportunities for learning, and oftentimes learning in a much more meaningful way than in the classroom. In the community, seeing firsthand those either health inequities or opportunities for improving people's health. Those organizations exist everywhere. So.
Yeah, and I think you raise a really good point there. I found in my experience at medical school that it definitely is being introduced into our curriculum. In my first year, we had a short course in the social determinants of health. And even now, as I start my clinical years, we have like case write-ups where we examine a patient's condition, not from a medical perspective, but rather a public health perspective. So I think, yes, definitely it's becoming more mandatory for us to think in this broader sense.
Okay. And now for people potentially thinking of pursuing a career in public health like yourself, you have talked a bit about prerequisites for kind of going into this career. What do you think are the requirements for working in public health? What skills do you need, and what extra courses or degrees or experience should we be getting?
Yeah, I think there's a relatively broad set of skills that people use regularly in public health that are sometimes part of med school, sometimes not. Sometimes you have to develop them on your own. Whether you need a degree or not really depends on how you want to work in the field. Where I come from in Canada, there's people working in public health that don't have a specific degree that's called public health. They sometimes have a different some training or some life experience in a relevant context, and that allows them to develop skills as they're working, as they're progressing in their career on the job. Um, but the skills themselves, I think, are in a couple of big chunks, if you will. So there's technical skills. So that's things like epidemiology, being able to have the medical expertise, the knowledge around the specific public health issues that you're working on, um, the capacity to analyze and critique data. So all of that, that's kind of technical. You learn it. You have to understand what you're doing, and you have to be able to use it as a skill. Then there's also the leadership and the management skills. Oftentimes in public health, deploying a public health program, project, organization, you have to be able to manage people, and that's an important skill for some of the roles. So being able to clearly make decisions and base those decisions into evidence and have people believe in them and follow you, being able to report back and show to people what you've managed to do in order to continue mobilizing resources, and being able to hold a team together and have people understand a common vision and work together towards a common goal. They're all also important skills. A bunch of soft skills, or things that we call soft skills, like communication, the capacity to bring people with different perspectives together at the table, bring people with different understandings of an issue, and I think we can say cultural understanding, but not the culture not only in the sense of ethnicity, but also culture from the sense of academic background, for instance, or experience background, which can make people see a problem completely differently. That's an important soft skill, to be able to understand that others have different perspectives, and that taking those different perspectives together is always beneficial. You won't always please everyone, but I think understanding that there's those different perspectives is important. Yeah, I think those are the kind of core skills that people need for different roles in public health. And you can acquire some of them through academics. You can acquire some of them on your own. Some are more easily acquired through academic training, but obviously not everyone who does public health has a master's of public health, an MBA, and I don't know, has complete, like, is a perfect communicator in all sorts of contexts. Those are different things that you can choose different tools to get to learn about.
Great. Yeah, I really like the idea of perspective taking and bridging kind of people's understanding of a situation and trying to bridge that gap essentially. I think that's a really good piece of advice. And from your work and life experience so far, how do you think medical doctors can do the most good with our resources?
Yeah, I think it's up to everyone to find their path or their way of doing things, or what interests them the most, and then pursuing that. I think that some people want to do public health, some people will choose to do very very specialized clinical medicine, but all of those functions are essential for people's health. I've essentially pursued what I found most fun at different points in my career, and it's always led to interesting opportunities, and then sometimes things that I chose to pursue, other times things that I chose to not pursue because I didn't have time or more resources. I've often done many things at once because I found them all exciting. So essentially kind of doing things that you like, and figuring out what you like along the way, and it's okay to change your mind as well, I think are all different pieces of advice that I can give.
Thank you. Yeah, I think that's some great advice. Kind of going with what you enjoy is often a good guiding compass. One question I have, just relating back to what we were talking about before. When you chose your career in public health, were you thinking about impact at the time, or was it more just that you enjoyed that field, or were you consciously thinking, this is an area where I'll have a larger impact than if I pursued X career in clinical medicine? Was that conscious?
Yeah, I think I was thinking of impact, but um, I think it's important to not discount the other ways of having impact. Having like a very big impact, if you are a cardiac surgeon on the one individual, it's equally necessary and valuable in a functioning healthcare system or in functioning society. So the desire to have, if you want, broad impact on a large population, as in public health, is a different desire. It's also an impact. Both are impactful. That's what I mean to say. So yeah, I was thinking about that, and I took the decision in part because of that. But I think other very contextual things, like me wanting to continue to be involved in some activities and recognizing that through a public health residency, I would be able to like combine some of my interests, was also part of it.
Kind of just to end our discussion on kind of a high note, of all the things you've done so far, what are you most proud of, and what do you think has done the most good, and why?
Yeah, I don't know if it's done the most good, but I think in many of the things that I've done, I've tried to, I've often done things that weren't necessarily done before or that were new or trying to start new things. And I've tried to create opportunities for others to either follow or to do something that I wish I could have done, but that wasn't there. And there's like concrete examples of that is, for example, the creation of a youth delegate program to the World Health Assembly. This is something that existed in other UN bodies but didn't exist at the WHO, and we advocated. This is advocacy that I started doing with IFMSA in 2013 and continued for many years, including with the Junior Doctors Network. But it led to the creation of many such programs in many different countries, including Canada, one of the first ones, and one that's still running to this day. So it's the fact of having created something that benefits others. I've never actually been a youth delegate. I just advocated for the fact because I thought it was something important. I'd seen it working elsewhere. So that's something that's at least I'm quite happy worked out, and that it still kind of has momentum. More and more countries are joining. The numbers are exponentially growing from year to year now, and there's still people that are kind of still dedicating effort to it. So very glad to see that. And other things, I think you mentioned it earlier, the WHO Youth Council. It's something that was created through a lot of effort over many years, but is now kind of definitely taken off, is functioning, and is striving to even improve itself as a mechanism of engagement, which I think is very valuable and creates more opportunities for more people than those who are already in this space.
That's so cool. And thank you so much for creating these opportunities. I know that having these programs and committees and societies where students that are interested and can get involved makes a real difference and can really help shape our career paths in the future. So thank you.
And finally, what do you think is the number one listen or must read for anyone interested in pursuing a career in public health?
I don't think I have a very good answer. I think it's very kind of personal, individual. But I mean, personally, back in high school, I had read The Hot Zone. So like it's a romanced history of hemorrhagic fevers, discovery, and travel around the world, and so on. This being said, there's many great books about public health and global health. I can recommend the list. Madhu Pai, he's a professor at McGill. He maintains a list of the must-read books in global health, and that list has over the years grown. That's easily findable. If you Google global health Madhu Pai, you'll come up on that list, and you'll be able to find something that pleases your own interests. So
thank you so much. I'll have those all linked in the show notes. So I think that wraps up our discussion today. We've covered a range of different topics. We've kind of had a whistle-stop tour of your career path, the decisions you made to pursue a career in public health. We talked about health advocacy, diplomacy. We talked about prerequisites and skills you might need to develop, and all of the factors surrounding why health representation matters. And finally, some really interesting advice for those interested in pursuing this path. So it's been really, really rewarding to talk to you today, and I hope our listeners will take away a lot from our discussion. So thanks a lot, Dr. Tcholakov, for making the time to talk to us today.
thanks for having me. I hope people like it.